But a glass encapsulated animal tag only begs the question of the definition of what type of animal, and if that definition is a mammal, certainly it would include man. Are there humans running around somewhere on the globe with tags, RFID tags implanted in them? Yes, absolutely conclusively so.
At least 6 million medical devices a year are implanted in human beings, everything from vascular grafts to breast implants. The United States Food and Drug Administration has implemented a new ruling called the Safe Medical Device Registration Act of 1994. This act mandates that all prosthetic medical devices to be put into human beings must be tracked from the time of manufacture through implantation and possible eventual removal. You'll never guess where a radio frequency identification device has shown up now, in a new type of breast implant. In order to comply with the Safe Medical Device Registration Act, the breast implant contains a Hughes RFID chip. It is currently being tested in 100 women in Britain, Italy, and Germany.
The RFID device, which is actually physically attached to the breast implant itself. A really interesting aspect of that is that once the breast implant is implanted in the patient, the radio frequency transponder can be read after implantation, and so that many years following the implantation of this device, that registration number can be read by the patient going to a hospital or a doctor that has a reading device. Inside this circular area is perhaps very hard to see, but a slight line of outline here of a linear device, and that is the radio frequency transponder that's been associated with the breast implant insert itself at the time of manufacture.
Radio frequency ID is positive identification when an RFID chip is implanted in the human body. But by linking it with biometrics, identification is just as certain even when used as an external tag. The U.S. government proved that in the Caribbean with a program they call Deployable Mass Population Identification and Tracking System. As the Coast Guard rescued wave after wave of Haitian refugees from the angry seas, identification and processing became a major problem. Before the flood of humanity began to slack off, more than 50,000 Cuban and Haitian refugees had been processed at the Navy base at Guantanamo Bay. Identification of the refugees originally was accomplished with a simple hospital-type plastic bracelet with a slip-in identification card, but that quickly proved unsatisfactory.
They needed to find a way that they could process these people much faster, give them a much better stay while they were there. So we got into the development of the electronic identification bracelet, which is basically an identification card. Each number was unique. They could process them very quickly electronically. As I stated, it only takes 39 milliseconds to scan and pick up the unique ID number. You could process people very, very rapidly.
In its final form, the Deployable Mass Population Identification and Tracking System consisted of an electronic RFID transponder bracelet, a digitizing camera, and a digital fingerprinting system, all linked to a computer database.